and they decided to talk to me about it. And I talked to Eileen, and here she is. She's our special guest. And what's so cool about Eileen is, as you saw, she is very degreed. She's not only a nurse, but she also has her degree in social work. And she went through the epicenter of the COVID-19 pandemic. I want you to, I'm recording this, Eileen, if that's okay. I want you guys to be able to digest everything she's saying, but just as a reminder, we can't really use COVID and Juice Plus in the same sentence. So when you're talking about, we can talk about how you might want to word some of the things that you want to share that Eileen's going to share tonight, because I spoke with her and it is really going, it's going to be I'm so excited. I'm beside myself. So Eileen, we're going to have a conversation, and then in the end, I'm going to ask people to ask you some questions, time providing, which I'm sure we will have time. So I'm going to put you on speaker view so that when you start to talk, your picture will be highlighted in the recording. So tell us a little bit about your personal story and your personal history.
Well, so I'm a nurse, normally on a surgical unit where we take care of, elective surgery patients or cancer surgery patients, orthopedics, urology, plastic surgery, pretty complicated. It's a step-down unit. I'm not quite ICU. In the beginning of March, when everyone started talking about COVID and how we were going to handle it, we all kind of, whatever, you go with the flow. Most nurses, you deal with a lot of gross, really strange things. We deal with TB, we deal with contagious diseases all the time. But ultimately, when we realized this was going to be a big thing, my floor had the first 2 positive COVID patients in the hospital. They were surgical patients that became positive during their hospital stay. So they clearly got it from a visitor or from a healthcare worker. I made the decision on the 17th of March to send my children to my ex-husband's, so that the decision was there's 35 beds on my floor, and the entire floor was going to be COVID positive. We were the second unit in the hospital of over 800 beds to go COVID positive. Within 3 weeks, the entire hospital, except for transplant, was COVID. At one time, Mount Sinai Healthcare had over 2,000 COVID positive patients. So as anybody who knows me knows, I am never alone. So that first issue of sending my kids away, telling Jason not to come down to New York City because I was going to be, taking care of 5, 6, 7 COVID positive patients every day. We did not necessarily have a PPE issue on my floor. We definitely modified how we used it. So
what does that mean, PPE?
Protective equipment, all these sensational stories that we heard about with the masks. So initially we were only wearing the surgical masks like everybody's wearing now. It was not considered anything but a contagious illness, not droplet or airborne, where we would normally wear the N95. After about 8 days, they decided we had to wear N95. So many of us were probably exposed prior to that. So we start wearing N95s. I mean, there are some pictures of we had to wear a face shield, an N95, a surgical mask, a surgical gown, cover our feet, cover our hair every single time we went into a room. So that was stressful, exhausting. My face was cut, my nose was cut, all really minor things with what was really going on.
Eileen, did you have to take off everything after you saw one patient and put it all on again to see the next?
In normal situations, if we were dealing with an infectious patient, that's the way it was done. But according to the CDC, during this, we were allowed to keep the N95. We changed the surgical mask in between each room. Not the only thing we changed in between each patient in the same room were gloves. Because you're touching a patient, but because everyone had the same infectious disease, we shared the the personal protective equipment. You know, there was other things that put us at really high risk. Anything that created aerolizing with a patient, like a special, you know, almost everyone on our floor was on oxygen support of some kind, something as little as a nasal cannula. You know, like our air has about 23% oxygen. When we put something in somebody's nose, it gives them about 50% oxygen. When we cover them, their mouth, it gives them about 80%, but then there's other machines that are giving them 100%. Anything that was given above 80% would actually move the droplets around and put us at greater risk. And in normal circumstances, those people would be in something called a negative pressure room so that the particles didn't fly around. They were not on our floor. We had 2 patients on those machines, you know, so when you opened the door, all the particles were going around. So we kind of put that out of our head, you do in a way, while you're at work. You know, when you leave work, you realize, okay, everything has to come off. I went home, my house was never as clean, my body was never as clean, I washed my hair every day because you just never knew what got in. You know, and then as time progressed, people, the patient, it got sadder because some of my coworkers got sick. I had a nurse, a colleague that was hospitalized. Her husband, who's a diabetic, was hospitalized. She brought it home. Her 2 adult children were hospitalized. Our housekeeper was hospitalized. So a lot of people got sick. Mount Sinai actually lost 4 nurses to the disease. They lost a nurse administrator, all stuff that kind of is kept quiet. But, you know, that was one side of it. The other side of it was the different kind of nursing that we were forced to provide. I'm a very hands-on, I mean, anyone who knows me, I'm sustained by physical contact. I touch people all the time, appropriately. And we were not, we were not allowed. You know, we didn't hug each other, which is, we needed to hug each other more now than ever, our coworkers. And our contact with the patients was so minimal. And these patients were alone at the hardest and scariest times of their lives. They were not able to breathe. Often the machines we put on them, we wouldn't let them eat or drink. And often the sheer nature of taking somebody off the machine, whatever it might be, even what we call a high flow, which, you know, we put people on regularly, their oxygen would, just to take a drink or eat, would drop so significantly that sometimes we couldn't get them back up. So there was so many components to the change of how I personally provided care, because I couldn't, you know, I walked away from people who couldn't breathe because I had somebody else whose oxygen and it was so much lower, or, you know, their heart rate was in the 190s, and, you know, if I didn't get there, they would stroke. So to make that clinical decision was I had some of the hardest moments as a nurse and as a human, actually, during this. And then I came home to an empty house. I came home to my dog. You know, I couldn't see my kids. I sent my kids away March 17th, and the first time I hugged them was on Memorial Day.
Wow. Wow.
And so some of the things that were so prevalent and so, you know, that first weekend, Friday, Saturday, Sunday, a lot of people died. And we don't see people die on my floor. And sometimes they died because we made mistakes with how to treat them. Normally you have a patient that comes in, if they have a high fever, their heart rate is high, they're tachycardic, we give them fluid, and that lowers it down. They're septic, right? Sepsis was a big trigger term a couple years ago. We treated everyone for sepsis, and it killed them, basically, because this disease, this virus, presented itself so differently that the immune response, you know, most of the people, so to get to why I want to do this, why I was willing to even put myself out there, is most of the people that were admitted to the hospital, so a lot of people got this virus, very small, less than 1% actually got admitted, and then a smaller rate of people actually died. More than 80% of the patients that were admitted to the hospital had a BMI greater than 30. You know, so they were already, like I was speaking to you more, like when you're overweight or obese, your body's in kind of a chronic state of inflammatory response. It's working harder to breathe, you're harder to walk, you know, it's fighting off potential autoimmune conditions like diabetes and hypertension. And so then what happens when this coronavirus entered their bodies, their body had the appropriate inflammatory response, the immune response, which is your inflammatory response, to, you know, send in the fighter cells, send in the cytokine to, get rid of the virus. For some reason with COVID, when the cytokines came in, instead of, causing the COVID virus bacteria or virals, whatever it was, to leave the body, it attached to it and kind of made it was like a quicksand in these people's lungs and in their bellies, because we saw a lot of, initially, of course, it was viewed as a respiratory disease. Then we saw a lot of GI symptoms. And then towards, April, we realized that there was really a strong hemolytic component and everybody was clotting. But when you looked at people's chest x-rays, everybody's chest x-ray was the same. In that part of their lungs, it looked like glass. So when you have somebody who, there's been studies, Mount Sinai did a study, and there was an article in New York Times that obesity has been determined as the #1 predictor of having a severe reaction to COVID. And so that was one truly prevalent thing. Certainly people with diabetes and asthmatics did poorly. Of course, many diabetics, type 2 diabetics, and type 1s, which of course they can't help, are obese. And then the hugely prevalent, I know there's a lot of articles and things in the paper and things about minorities, but we saw it was very heavy. And we did, again, some research also, which I'm involved in some of that at the hospital with infectious disease, and that Hispanics do have a higher obesity rate than any other racial group. Why that happens, I don't know. There is some idea that, they have less access to healthcare because there's a larger undocumented Hispanic population. We're not necessarily politically friendly health insurance wise with Hispanics, so they probably sought help later. And in most of the areas where there's Latin populations, the food choices are awful. I live in Spanish Harlem and the food choices are awful. So these people came in with a BMI greater than 30. Maybe that was the only thing. I actually spoke with a critical care physician, an intensive care physician, a young, probably in her 30s woman who really struggled with a lot of her decisions as a physician. And she told, for me, it was tough. She had a 44-year-old man with a BMI of 41 who came in on a stretcher.
Who overweight is that? 40.
Yeah, thank you, Jason.
Obese. It's in the obese category. So he's
So is he like 300 pounds? 400?
Probably 380, 400 pounds. And a 74-year-old woman in good shape. And she had to make the decision at that time who to put on a ventilator. And she chose the 74-year-old because the outcome, her outcome to successfully beat COVID was greater than the person with obesity.
And how old was the guy?
4.
How old? Kind of cut out.
4.
44. Okay.
And so the sad part about what's happening is we live in a culture now that we don't really see obesity as abnormal or a problem because it's so prevalent. Right. So people think it's okay to be heavy. And so now we've gotten through this acute pandemic phase of COVID, but we're not doing, I don't think we're doing enough to, help people be healthier. So like during COVID, everybody talked about all the things that nurses got. We got food and we got drinks and we got treats. We got donuts and we got caffeine energy drinks and we got fettuccine Alfredo in prepackaged things to heat up. These were not healthy choices. I've struggled with my weight my whole life, on and off. I've been 40 pounds heavier than I am now. So, I'm at a place now where, I make good choices. When I met Jason, I was a very hard sell, he'll tell you, for Juice Plus because I had a good diet and I, said I get all my nutrients from food and all of that. And I couldn't have been happier that I had Juice Plus for mental health reasons, because I at least knew that if I was taking my Juice Plus during this pandemic, that I was getting my fruits and vegetables. I was getting my antioxidants. I was getting something healthy for myself, that if I ate crappy, which I did at times, I definitely came home, and Jason will attest to a few times I came home, a nip of brandy and, a beer too much or whatever. And, that was my stress relief. I cried a lot during this time. But I did my best, and I really, really did my best to make choices that didn't put me in a risky category. And these people that I took care of were really far too ill at the time to talk to about these things. But now we're in this, interesting situation where there's still patients in the hospital that were admitted during COVID. And they're technically COVID recovered, but they're on ventilators and they're bed sores, and the nutrition's terrible in the hospital. And to try and
Why is it bad why is the nutrition bad in the hospital?
well, one, they're feeding 800 beds in the hospital, and there's how do you feed 800 people? We do. People can get salads, they can get fruits, but we don't tell them that. We don't tell them because it's easier. People want to do the least amount of work. And healthy food, people think healthy food is expensive, or they don't even know what to choose. And Jason, you and I have talked about this. Let's say in certain communities, people who, let's say, go to McDonald's and choose to have a filet of fish instead of a Big Mac think they're making the healthy choice.
Right.
Instead, let's not McDonald's, let's go home and make our food. And so the reason why I agreed to talk, which is not my forte, I'm not comfortable in front of the camera, but I saw a lot of really horrible things that are etched in my memory, things that I'm probably going to need professional help for. I've cried a lot over how sad people's lives were. And now we're in this lull, we're in this downtime of what we can do for people. And it's so easy to know that we know that obesity is a low-grade systemic inflammatory response. We know that, it releases.
Explain what that means, low-grade inflammatory response.
When you're obese and your body's working hard to walk, to breathe, for your heart to beat, if you have heavy people, your heart. So when your body has to work hard, right? Think about if you lift something heavy and you lift at work at the gym, your body hurts. That's inflammatory response. There's your joints are mildly inflamed, the pain. So your body's in this constant state of inflammatory response. And we also know that adipose tissue fat is a cytokine. It emits cytokines. So then these people got into this. The cytokine storm is not an official term, it seems, but it was the term that we used to describe what was going on for people. So of course, people they thought that people who had cancer, ones that suffered, but they weren't, because they were on all immune modulating drugs. So their immune systems responded really it was a really sophisticated response. And then this whole issue of, the testing, we didn't test.
Talk about the testing. There's the COVID testing for the antigens, and then there's the COVID testing.
Right.
Tell us.
Right. During the whole pandemic, we only tested people for the actual illness. So that was the nasal swab. In the beginning, it was sent. It took 3 days to result. We put a swab in each nostril, and people would say, you better feel it in your brain. I had it done. You do feel it in your brain. And that tested whether or not you had the illness presently. Did you have it? So then we realized that the plasma with antibodies was one of the greatest treatments, among other things that we saw that worked. But you don't develop antibodies 1 to 3 weeks after you're exposed. So I wore PPE, I didn't get sick. I certainly had tired nights, which I attributed to, being tired. And, I would like to be able to donate plasma if I can. And I got tested for antibodies. I wanted to be able to hug my mother, is really the reason. She's 80 and has a heart disease. So I went and got tested, and I have antibodies high enough to donate plasma.
Which means what? You can't give it and get it? What does a high antibodies mean?
Well, in the world before COVID, having antibodies essentially meant that your body had responded to a foreign thing, to an infection of some kind, and created the immune response. The antigens, so I don't know if people remember, like when people say if you have a titer, so like some people will, get shingles or whatever and say, oh, but I had chickenpox, so you didn't have enough, your antibody titer wasn't high enough to defend against the illness. So what your antigens check for, so that titer is your antibody immunity, but you need antigens to have them. So what the blood test is testing is really for your antibodies. And so prior to COVID, if you had antibodies, you were viewed as safe from the disease, at least for a period of time. A lot of infectious disease doctors are reluctant because this virus followed such a bizarre trajectory, not like any other, that they're reluctant to say that it's going to last for a long time. When I got antibodies, I said, well, so I asked the guy, I said, does that mean I don't have to get the vaccine? And he said, not necessarily. We don't know that yet. So, they're still testing, like actually right down my block today or yesterday, they opened up they're still doing the nasopharynx testing, the nasal swab, and sending it. So because the antibodies don't test for, the only thing that tests for a current infection is the nasal swab.
And that doesn't mean you won't get it tomorrow.
And so that's the issue. People are testing, like nursing home workers, are tested once a week when they're going to work, and nursing home patients are still dying. So people are still bringing it in somehow. So, it's a test, so nothing's perfect. We had people that were tested. So like right now in the hospital, everyone who's going for elective surgery, it's costing the hospital because they have to come in 24 hours prior to surgery. Normally they would come in, go directly to admitting and go to the operating room. They have to be pre-admitted. They have to have a nasal swab done by Mount Sinai within 24 hours of surgery, or anesthesiologists won't intubate for surgery because it puts them at such high risk. We are not accepting now my floor is mostly back to our urology cancer patients and our elective ortho patients and breast patients, plastic surgery patients, and our orthopedic surgeons kind of they were angry about us accepting COVID patients. So unless there's a surge, we're not going to have COVID patients while we have elective surgery patients, which is a great thing. People are, right now, there's less than 100 people at the hospital that are positive, which is great. We're still seeing there's still people recovering. Mount Sinai opened up their Beth Israel ambulatory care for COVID patients, of course, because they want to keep the money. It's all a money game. They want to keep these recovering patients. But I don't know that you don't hear it in the news talking about the obesity issue. But in hospitals, we're talking about it. A lot of people who make choices to eat poorly are also smokers. Smokers got desperately ill also. If you come in already with a pre-existing lung condition, you really, really, really suffered. And I know I'm not going to use it in the same sentence, but a company like Juice Plus that's been around, long before a lot of trendy, healthy things, and I said one of the things I said to Jason when he was talking to me about it a year ago, I was like, it's kind of expensive, but so is a Big Mac, and so is a Starbucks, and so is Popeye's chicken, and all the choices that people are making.
Which, by the way, are all in your neighborhood.
All within a block of me. It's absolutely insane. Taco Bell. There's not a salad place in my neighborhood. There's not regular diner that if you wanted to get a salad within 3 blocks of my neighborhood. I live in Spanish Harlem. And so I don't want this. I don't ever obviously want to live through caring for patients that were as sick and as sad and as scared because they were alone. And that's why Jason had asked me, I'm going to talk to Maura. Will you talk? And I was like, Jason, it's not my thing. And, as I talked, I said, I do love to teach. I love to educate. I love to do it on a smaller scale than this, but I really want to be a part of something that can maybe help 1 out of 10 of these people not end up on a ventilator, not end up, choking for their last breath. And that's how people died. People died, they choked on the quicksand and and they died, with their family this way on a Zoom call. No one knew.
Eileen, I know that Juice Plus was very, gave you peace of mind and gave you an armor. It seemed to me when I talked to you several times, each time I kind of felt like you envisioned an armor around you to protect you. But talk to us about that. What did the nutrition of Juice Plus do for you?
Well, so like I said to you a little bit this morning too, more like there's so many ways to approach nutrition. And as somebody who struggled with their weight their whole lives, for me, there's a huge mental health component. So, we love to approach it from a very scientific, this is healthy, your BMI. It's just not the way some people process information. It's not the way, and I'm a nurse, I love science, but for me, it has to be something more than that. So I used to I gave out more Juice Plus meal shakes to my colleagues during COVID, probably a box, because I was like, don't eat that shit, have this, like just drink that. And yeah, it was, for me, I felt obviously like I was taking care of myself physically, but it was a mental health thing that I knew that despite what I saw, I definitely felt bad for myself. I definitely had, sappy moments where I was miserable. But when I knew that I had at least put in my body something that was good for me, something that helped me at that time. During COVID, and that was the one thing about the nursing during COVID was it's the first time as a nurse that it permeated my entire life. The blessing of a nurse is you have your patients, you hand them off to another nurse, and you can go home. And that's what I loved from nursing as opposed to social work. But this permeated every aspect of my life, my home life, my health. I stopped, I had no gym. I had no gym, nothing other than Juice Plus to keep me healthy. There was days I was like, Jason was a huge advocate, obviously would say, it's like, at least I took it, and I would take it 2 or 3 times sometimes on really bad days, because there was days I chose not to eat, the pre-packaged spaghetti or chicken Alfredo that I had to put in the microwave for 4 minutes, and I would have a shake instead and feel, feel so much better in my brain. I definitely better physically too, but it was more about my mind, what my mind was able to do. And I said, I can keep going now. I worked, we typically work 3 12-and-a-half-hour shifts. For the 6 weeks that my unit was COVID, we were 6.5 weeks COVID, and I worked 5 shifts. So I worked 60 hours every week.
Wow.
And I do have a lot of energy, and I'm not sleep and stuff at baseline, but I was definitely like a Juice Plus junkie during this. So
I'd love to open it up to questions, but what I'm finding, Eileen, is when anybody talks, it cuts you out for whatever reason. So I'm going to put it on gallery view. And if you want to ask Eileen a question, is that okay with you, Eileen?
Of course.
If you want to ask Eileen a question, I hate to ask you to do this, but just to keep the lines clear, can you just kind of let me call on you and you unmute yourself and ask your question and then mute yourself? Okay, Sue Lambiers, saw you first.
Thanks. I had a question. What did Jason say that finally made you share it? And, how long did that take? Like, did he have to tell you 10 times? And what was the one thing that finally resonated and said, yeah, I have to do this?
It definitely took him 2 months.
My witty charm.
Yeah, I should have said that. It was his beautiful face. No, he shared them with me first, because of course. So I'm the daughter of 2 Irish immigrants. My father is 80 and never been to a gym, never eaten a slice of pizza, never eaten a hot dog. My father's been organic for 20 years, long before it was trendy. And as Jason has met them, and all he says is, you should get everything you need from the earth. And so in my brain, I was like, they look like pills. I don't take anything. I don't take any medicine. I'm not on hypertension meds. I don't take nothing. And so I was like, I don't need the pills. And he's like, they're not pills. So he sent me probably daily, some of the studies that Juice Plus did. And then I forget when your convention was. So the thing that made me decide to do it, aside from the fact that it definitely, looked fantastic, but I was like, how do you put all these things in a capsule, was the fact that it is the convention for Juice Plus is considered a medical convention. It is not like, a lot of companies that are out there that, and the fact that it didn't boast weight loss, right? Everything that, and that's not, I don't want to make that correlation that Juice Plus is weight loss, it's just about health. I didn't need a weight loss pill. I know that, and so the fact that this was so clinically based in scientific evidence, that was huge. The fact that I was like, wow, I could actually get approved to go to the Juice Plus conference from work because it's considered a medical convention. It's not considered a nutrition convention. It's not a marketing.
Say that again. You can get approved by the hospital.
Right. I can go because we get approved for medical reasons. We can go on medical conventions, but that's the only thing they'll approve. And they would approve me attending this convention because it's a medical convention. That along with, he definitely used, it's less than it's $2.50 a day. It's a Starbucks. I don't buy Starbucks. I don't ever buy coffee, but I definitely buy a slice of pizza. It's 2 slices of pizza a day. The fact that it's really not that expensive. And then he sent me information. I had just a thought, I lost it, about, about the whole autoimmune response and all the studies that have been done with Juice Plus and people who, have lupus and hyperthyroidism and things like that. And just the whole scientific research, the double-blind study, the fact that Juice Plus doesn't do its own research and present its own research, the fact that their research is double-blind, because I did a ton of research. I've written a thesis, for my master's degree in social work. And, I did it a long time ago when, you had to walk the streets and stuff. And so for me, the whole double-blind study aspect, that coupled with the fact that it's a medical convention, and of course, Jason's charm. I have to throw that.
Who's thank you so much. That was perfect. Good
Thank you so much.
Who's next? Who wants to ask Eileen a question? Leslie.
Hi, everyone. And hi, Eileen, and thank you for being here and for putting yourself on the front line. I can't even imagine. Anyway, I would like to know what would be your top 3 recommendations for those patients that had COVID, or if you could have seen them before, what would be the 3 things that you would say to them?
So first, and this is so really on the topic, but one of the things that people need to do with regards to their choices in healthcare, we all have at least one person that we love that knows exactly what we want. Because even as a nurse, I had really, really difficult conversations with family members about making their loved ones DNR, DNI, and families saying, I don't know what they would want. So it's an uncomfortable conversation. No one in this group is old. No one thinks they're faced with their mortality. And a lot of these families were forced to make decisions for their family members, and they've had never had a conversation. That's a number one. It's a real problem in healthcare that people don't know what their loved ones' wishes are. That would be my number 1. My number 2, and my number 1 thing that I talk about with, I have four children, choices. We make so many choices every single day. We choose to brush our teeth, to wear our seatbelts, to do all kinds of things. Now we're choosing to wear masks and doing all this. Every day, we have to think about our choices, and that every single choice has a consequence. So I mean, I walk by fast food places every single day, and every now and then they smell fantastic. And I want, I mean, I've had pizza and I availed of the shit food that we got. But if people, we need people, more people in the lesser socioeconomic industries, people who are lesser educated, we need to help them know what their choices are. Like I said to people, I always say to patients anyway, like, you can order a Caesar salad, you can order a fruit plate instead of a chicken burger and fries. And they're like, really? The education piece about the choices, you can only make choices that you have. And a lot of these people, I don't mean these people, Hispanics, a lot of people who got sick only made shitty choices. Not all of them. Some people got sick. Some people just got sick. And that is for real. Some healthy people who were not fat, who were not overweight, who didn't have pre-existing conditions, essential workers who were exposed. Some people just got sick. And I would say that the third most important thing after you're making your good choices is when you do get sick and when you're not feeling well, you need to get the help that you need when you get it. One of the reasons why we think Hispanics also, they didn't go for help because they didn't think they needed to. They didn't have insurance. They were afraid. People were afraid to go to the hospital. We need to help people have better access to health insurance. They need, goes back to my first point, that everybody needs an advocate for their healthcare issues. Self-care is a big thing. I'm not good at it. I am, a very religious Catholic. I pray a lot, and we do have whatever it takes, like the meditation that you do is about self-care. We all need to make choices that make us take care of ourselves.
Exactly. Beautiful question. Wonderful answer. Thank you so
Thank you.
much. Who else wants to ask a question? Ham.
Thanks, Eileen.
Hi, Hamilton.
This is awesome, and you are doing an amazing job. So really, thanks.
I watched a lot to learn.
How, it sounds like the decision process that you made with Jason's help, nudge, nudge, wink, wink. It sounds like this information is embedded in you now in a much deeper way, obviously. How do you see yourself at this point, sharing it, or do you feel, we've heard from other health professionals say before, they almost feel like now that they know what they know, they feel it's like a moral obligation to share. Do you have any thoughts on that going forward?
Goes back to, you can only make choices that you have. Like, I didn't know before I met Jason. I didn't know that I would have benefited from something like that, right? I was healthy, I exercised, I ran, I drank my water, I did everything that everybody says you should do. So why do I need that? So I definitely feel really strongly about when you read even just the basic study about Juice Plus. Jason loves to give pages and pages, but because that's his thing. But the fact that what each pill contains, your antioxidants, your phytonutrients and things like that, it is definitely a passion now, right? So, nutrition in general, and, I'm getting older also, but then this COVID thing, this pandemic, more than ever. I was vigilant. I was good about taking the Juice Plus before, but I never took a double dose, really. I haven't been sick in 15 years. That was the other thing with Jason. I've never had the flu. I don't get a headache. I haven't used a sick day for really sick in 15 years, and I have 4 children. So I was like, I don't need it. And then, there was part of me that was like, oh, he's a new guy. There was a lot of that involved with first buying it, of course. But it definitely during this pandemic became almost a crutch for me. So I definitely see myself. So I am definitely not a salesperson, and I I would be uncomfortable having these conversations with like to try and sell, but I definitely will connect Jason to people. I bought a tower. That was my big treat. And I'm loving my tower because the only thing I went shopping for regularly during COVID was salads. I haven't gone to the store. I haven't bought a box of power greens in 3 weeks because now I have my garden. And so that has been so much fun. And it's been so much fun growing that. And I actually love that I got that. That's been like my favorite thing on top of, taking my Juice Plus. This garden has been like the greatest joy. Like, and I bring stuff into work, my salads into work and stuff, and people can't believe it. People can't believe that I grew it in Harlem in my little backyard.
Have you shown it to your father?
Yeah. So yeah, Jason actually talked to my dad about it over the weekend, and my dad's he might be sold on it. He'd never take Juice Plus probably because he wouldn't take the pills, but he wouldn't take the capsules, even though we told him it's all natural, all that. But he's excited about the garden. I think he needs to come and see it. And like once I get tomatoes and things like that, like bigger things than greens, I think he's going to be impressed. I have like 10 squash flowers. I don't even know how this is going to go.
One last question. Who would like to ask? Susie.
Thank you so much, Eileen. This has been really, really good. I really appreciate it. So on the inside scoop, Mount Sinai, what are they talking about a vaccine? Do they see anything coming anytime soon? And being a healthy, person yourself, would you get the vaccine?
A big question. It's a big question. So there are the Icahn School of Medicine, which is a school of medicine attached to Mount Sinai, along with the infectious disease, because Mount Sinai was not necessarily my facility, but the healthcare system was pretty, they did a lot of the research. They did a lot of the recommendations of the immune modulating drugs that people took, the seleniumab and the tocilizumab, that helped people. They started the Plaquenil and then they really got rid of it quickly. They were the ones that said everyone needs Eliquis, because it became hemolytic. And so I actually had a conversation with an infectious disease doctor, Dr. Niebart, a week ago or 2 weeks ago, because I asked him, I'm like, so am I going to need the vaccine? And he goes, well, if we get it. So they are working on, so they claim that he said that will definitely be a functional vaccine by the end of the year. And so will I get it? I'm a nurse and I'm supposed to say yes. I am going to be nervous to get the first round of vaccines. And I'm just being honest, because anything made that quickly, it brings me back to thalidomide that a lot of women took, in the 50s, and then they had these disabled children a generation later because that vaccine was made quickly. There's a tremendous race economically to be the first person to make this vaccine. It's a boom. So I would definitely be asking a lot of questions of infectious disease doctors. Will I get a vaccine when it's true and tried? I will. I will be nervous to get the first round, though. Honestly.
Can the hospital force you to do that? Can they?
So, for instance, the flu shot, it's required, and if you don't
how'd that work out?
I didn't get it.
I know you didn't. I did. Whatever.
Don't get the flu vaccine, you have to wear a mask from April to October. So they don't necessarily force, but it's very discouraged if you don't. So they haven't actually made a statement about whether they're going to require us to get it. Of course, they're going to wait until we're closer to getting one.
I cannot tell you how much I enjoyed this. Thank you. We all did. We recorded it. It was so valuable. Everybody, you can unmute